Hi, I'm Dr. Ryan Oughtred coming to you from HealthOut Fitness here in Vancouver, BC. We're bringing health, which is way over here, and fitness, which is way over here. We're bringing them together to make you healthier, keep you in the game. We're going to health fitness out. So, preventing back pain for running. This type of movement here in my hips, and this type of movement here in my hips is not good for running, or at least if you have back pain. So I'm going to show you 3 different exercises that can limit the amount that happens when you run. So take the feelings that you have from these exercises, and when you do start to run, start running slow, try to bring these feelings into the running. I'm going to start with a hip flexor stretch. So it's like the top of your split squat. You're going to shift your weight forward as you normally would in a split squat. Tighten your tummy muscles up and feel your hips tip back like this. I'm trying to flatten my lower back out. I'm going to put my arms up in front with them straight and try to twist as far as I can each way in the upper body without letting anything from my belly button downwards twist. So the twisting is happening all in my upper back, and I'm keeping my lower back nice and controlled. Because I'm turning my hips back and I'm using my lower abs strongly, it's a bit easier to keep your lower back controlled this way anyways. Then I would do the other side. So for this one, you have the Kaiser Performance Trainer. You could use a band, or you don't even need to use a band. You could just go against no resistance at all, but I'll demonstrate it with a little bit of resistance. So you don't want to have too much of this movement if you have back pain. When you run, you want to keep the low abs set and use your glutes. Try to use your glutes without overly using your back or your hamstring down here. So I'm going to sweep the leg forward to 30 and just back to even body. I'm tightening my tummy muscles aggressively, and I'm thinking about this pelvis, this hemipelvis on this side isn't tipping forward, and it's not going like this every single time. It's staying perfectly level. So my tummy tightens here, and maybe I actually even switch my back on just a little bit here to keep my hips level. Tummy tight. And be careful that your hip doesn't drop too much like this, and then you end up bending this knee. You want this leg nice and straight, and the way you'd be able to keep it straight without it dragging is by using the muscles on this side of your hip. So a minute of those, or around 30 reps per side of those. Now we're going to work your hip abductors. You should be able to take this ball away, and I'm perfectly symmetrical still. And so I'm going to lift this inside knee up without losing that nice straight position. I'm not going to let my hips drop or twist. I'm not going to lean out from my upper body. I'm just going to pull this knee up and hold. I'm feeling it in the side of my hip, but a little bit more hopefully in the back side of my hip, into my glutes. So if you want to see any progressions from those, you're welcome to comment on the blog and ask for that. But I do recommend that you don't do anything complicated with that one at first. Try not to squat up and down. Just work on being able to hold and keep the hips and everything in the right position. If you did 2 sets of all the things that I just showed you, around a minute to 90 seconds of each, 2 to 3 times a week, you should notice some improvement. Once again, thanks for tuning in, and remember, don't just work out, health out.